Hello, I'm Dr. Joyce Bassett, a cosmetic and restorative dentist out of Scottsdale, Arizona. I'm an accredited fellow with the AACD and a clinical instructor at the Joyce Center. I love to write and teach, and today I'm going to share information on the latest in material selection for our provisional restorations, so we know when to use what, where, and why. When I was in dental school, dental materials was one of my least favorite subjects. I didn't see any correlation with what we would really be doing in our dental practices. But as I started practicing, I saw that many of my failures occurred because I wasn't utilizing the proper materials in the proper places. And so I started to have a value for material selection. So today we're going to review the ceramic choices and the provisional restoration choices that we have in 2020 and going into the future. We have feldspathic porcelain, lucite reinforced, lithium disilicate, aluminous, zirconia, and porcelain fused to metal. And this is a graph that really shows what categories each one of these materials falls into. So the one on the left are your glass ceramics. The one in the middle are your oxide ceramics, and all the way to the right is your metal restorations. The materials on the left are weaker, and the ones on the right are stronger. The ones on the left are more translucent. The ones on the right are more opacious. The ones on the left are more gorgeous, and the ones on the right are not as pretty. So we start to utilize and pick the material that we think is proper for all of these different indications, so we use the right material in the right place. So let's review each one of these materials. We have feldspathic porcelain. The strength is 80 to 130 megapascals, and the flexural toughness is 1. The next choice that we have is lucite reinforced, and this was your Empress and Authentic. The strength is 100 to 160 megapascals, and the flexural toughness was 1. Then we have lithium disilicate, which is our EMAX restorations. That strength is 500 megapascals, and the toughness is 3. So now you see the materials are getting stronger. We have a new material now that we can use. It is a self-curing composite, and we can use it for a provisional. And the toughness of the flexural strength is right at 2, between the last two categories of ceramics, and it's called Lexicron. It's a new category, I believe, called semi-permanent, because you can utilize it in both indications. Let's talk about provisionals and the prototypes that we utilized and the history, going back into dental school. So we started with methacrylates. There was ethyl methacrylate, which was our jet acrylic, and then methyl methacrylate, which was our snap acrylics. The methyl methacrylates were kind of stinky, and they made the tooth really hot, and it was really hard to use them in the mouth. And so the scientists went into the laboratories, and they made a new material called bisacrylates. And these materials had less heat, and they had less shrinkage. They were called bis GMAs, and they had really quick, faster setting times, but they were very, very brittle. The flexural strength was low, and the fracture resistance was low, so they would break. But they were really good for one tooth. This is a long span bridge. When I had to use these materials, I would reinforce the middle of it with ribond. It would still possibly break, but at least it would hold the restoration in place. What happens when I had people in the posterior that needed aesthetic restorations, or people that needed patients that needed strong restorations, like Bruxers? I had a hard time with these materials. And so the scientists went back into the laboratory and they made stronger materials. The next generation, and they were called LongTerm Provisionals, and 3M came out with ProTemp. And when we looked at the flexural strength, it was 96. Then Vocal came out with Structure Premium at 114. Then Lexitemp, which is DMG product, they came out, and their material was at 120. So every material that came out became stronger and stronger. And this was all we had in our armamentarium for long-term provisionals. Now, the materials were bisacrylic resins, and they added nanoparticles to reinforce it, and that's what was making them stronger. Now, the new material called Luxacrown, the fracture resistance is at 154, so you can see how much stronger Luxacrown is. You also can look at the hardness and all of the different attributes, and the Barco hardness is 66, so it's so strong that it's really hard for this material to break in the mouth. It's a semi-permanent restoration. So you want to think about it as being utilized between a temporary and a permanent. So something when you want to look at these indications that's longer lasting when you need these indications. So we had methacrylates to bisacrylics, which we've just spoken about, and now in the last years we had polymethylmethacrylates, which are called PMMAs. Here's a graph of all of the PMMAs, and you know we make these with CAD/CAM technology. And now you can see where their flexural strength are, and Luxacrown, which is a chair-side restoration, is even stronger than the other materials that are PMMAs. So let's think about the selection criteria for the provisionals, and how do we have to think, and when do we use them, and why do we use them, and where do we use them? So the first thing you can think about is if you have a complex treatment plan and a patient can't afford it to do the whole thing, then you could utilize Luxacrown on the teeth that they can't afford to go straight into a restoration of a permanent type like a Emax. They can utilize this crown to hold the space. Then you have people that can't afford the bridge after they spent all the money on the 2 implants, and so you could make a composite prototype Luxacrown bridge as a long-term or a middle-term implant restoration until they can afford the zirconia bridge. Then you have pedo cases, patients that have like a crown that's needed on a first molar and they're not old enough yet to have a permanent restoration accomplished. Then there's the older patients that can't afford it. And they could be old enough that they may not even have 5 years left to their life. And so you could theoretically utilize this crown as a permanent or semi-permanent restoration. Then there's patients going through cancer treatments or therapies, and their doctors don't want them to have long-term in a chair. They just want you to put something in to hold the space and get them out of trouble so they can go on with their therapies. Then there's cosmetic people that they can't afford 10. They can only afford 4 or 6. So you need to do 10 across the top. So you can utilize this material as crowns on the bicuspids while they can afford to have the work done, like in the following year. They can do the right side, then they can finish up on the left side. So you can stage treatment. I have many patients that Brooks, and they break the temporaries because the provisionals, they're so thin, we're doing a millimeter in the back. And so any of the other materials, they can break them just in the 2 weeks or the week that you're waiting for the material to come back in from the lab for the permanent crown. Then I open up the vertical dimension, and a patient, again, can't afford the posterior, or I'm going to open up the vertical, and I'm only going to do the first 10 teeth, and then I'm going to come back and pick up the posterior molars, and this crown can't hold the vertical dimension. And that also will allow you the time to stage the treatment plan. So again, let's look at when you would use Luxacrown and the indications. First of all, it's very affordable. It's $8 a crown, and you can utilize it on the old patients or the younger patients. Any implant surgical time while the patient is healing in the surgery, after an endo procedure and they can't afford the crown, and when you're phasing your treatment. Always in place of a PMMA if you need something quick chair side, and I always use it for long span bridges. I can utilize this material up to 5 years. And it comes in 5 colors: B1, A1, A2, A3, and A3.5. 5 different shades. I always have one of these cartridges with all the colors because I never know when I'm going to use or need this. And if I have an indication and I don't have it, then I feel like I will have a failure in the temporary or the provisional stage. So I believe that you need one of each of these cartridges in your practice along with your normal provisional material. Because in one cartridge, you can make 24 3-unit bridges and 36 single units in one cartridge. How do I use it? Exactly like I do all of my restorations for provisionals in the posterior. They're all the same. For me, I use Status Blue, which is a PVS alginate substitute. Now, when I take this, if the crown's not perfect in the mouth, I can use flowable composite on it, get the shape the way I want it, and then I can use this for two purposes. As a pre-op, or I can utilize it also, how I'm going to show you, in making my provisional temporary. So I'm going to prep my teeth, I'm going to take my impression, and then I'm going to take that PVS material and inject Lexicron inside of it. I have 30 seconds to get it to the mouth, and then I'm going to put it in the mouth, and I'm going to let it sit there for 2 minutes. I don't touch it. I remove it in 2 minutes. Then I'm going to let it sit on the lab bench and wait 5 minutes before I start finishing and polishing it. Now, this case, this patient is only 15 years old, and he's an Invisalign. So I can take this material and leave it in his mouth until he's older. Now, you can decide on your own, depending on the indication, whether you would like to use temporary cement, because you're going to pull it off sooner. And here I would use TempoSem from DMG. Just put a little bit in, put it back up. But in the case that I'm showing, I would utilize a more permanent cement and bond the tooth on the Lexicron, because I'm going to leave it in the mouth for a couple of years, maybe up to 5. So for Bruxers, I'm always going to use this material, and if I want to customize or characterize the facial with other colors, I can use Luxaflow on the facial, and it will bond to the material. Then we have PMMAs. You can't bond to them. And so one thing that you can't do with a PMMA is try to change the shape and the form in the mouth. It doesn't bond well. The fracture toughness, again, is really strong. 2, it's easy cleanup. And the longer it's in the mouth, the stronger it gets with time. In my practice, I use a lot of Luxa glaze. I polish it, and then I put the glaze on it, put the light on it, and that makes it really shiny. But if you're going to leave it in for 5 years, you may want to think about finishing and polishing it a little bit, taking a little bit more time. You're going to use a flame-shaped burr, and it's going to shape and contour, and it's going to get all of the embrasures, so you get all the contours the way you want them. Then you're going to use an interproximal disc that goes in the embrasure areas, and then you're going to polish it. You're going to use a stiff white goat hair with polishing paste on the buccal surface for 2 minutes, and then a cloth wheel, a felt one, for the final polish. It's going to look wonderful, and it's going to hold the glaze. So I hope that was informative, and it updated you on the latest in materials for provisionals, for Lexicron, for a long-term provisional that's like semi-permanent. And please look at me on Instagram, Smiles by Joyce, or Dr. Mouthy at AOL. You can email me with any questions, but probably the best thing to do is also visit dmg.connect.com, because everything's going to be on there. This webinar will be on there. And I want to thank you for your time and attention. I hope it was quick and fast, and now you know exactly what to do, where, when, and how. Have a great day. Ciao.